With summer around the corner and kids ready to hit the pool, parents may start to see more ear infections pop up. Repeated ear infections can be more than just a discomfort. They can affect hearing, speech, and even development. But one community health partner's pediatrician says there's a simple procedure that can help prevent long-term issues. Ear infections are common in kids, but when they keep coming back, there's a small fix that can make a big difference.
Ear tubes are small, tiny plastic tubes that are about 3 to 5 millimeters in length. They are placed in the middle of the eardrum, not exactly in the middle, but just in the lower corners of the eardrums, just to create a space for the middle ear to vent out the fluid that builds up in the middle ear. So this helps kids who have recurrent ear infections, blocked ear tubes, and blocked eustachian tubes.
Dr. Badrinath Kulkarni, pediatrician with Community Health Partners, says parents should consider ear tubes if their child has multiple infections in a short period of time.
Yeah, we usually recommend if they have like 3 or 4 infections in the span of 6 months to 1 year. We don't want to keep giving antibiotics for children because antibiotics have significant side effects.
In small kids, the tiny tube that drains fluid from the ear doesn't work as well as it does in older kids or adults. So when they catch a cold or go swimming, the fluid can get stuck behind the eardrum, and that trapped fluid can lead to infection.
And even after they get a cold or viral infections, the fluid remains in the middle ear for months. And then with that recurrent exposure to infections, like in daycare setting or multiple children in the family or older siblings, little ones can get recurrent ear infections.
While daycare exposure, seasonal allergies, and even family history can increase a child's risk for repeat infections, there is good news. Ear tubes are generally safe and can offer long-term benefits.
Usually, it's pretty safe. It actually helps the children not to get recurrent infections, not to get too many antibiotics, and preventing recurrent infections and helping ear tube drain will also help their speech and hearing in the long run.
Because repeat ear infections aren't just uncomfortable for your little ones, they can sometimes lead to more serious health problems if left untreated.
Yeah, we also need to discuss the complications of ear infections because ear infections are not always benign. You can have, people have heard about common ear infections. You go get antibiotics and they go away. But ear infections can lead to chronic hearing loss. It can lead to meningitis. It can lead to sinus infection. It can lead to periocular infection around the eyeball called orbital cellulitis, mastocytitis. So there is a chronic condition in the ear called cholesteatoma, which all need surgery. So to prevent that, it is better to get ear tubes placed and then prevent kids from getting recurrent ear infections.